payers are increasingly underpaying providers more and more, and using artificial intelligence more and more to really tip the scales in their favor. So we decided at SlicedHealth to build a platform that would really level the playing field and give providers the ability to get the money that was owed to them.
Hey, Ancil Lea here. Hey, welcome to another edition of LinkedIn Live. And hey, thanks for joining us today. Hey, I've got my buddy Jeff Beecher over here with me today, and I also have a really good friend, and Reed Legan. And hey, welcome, Reed. Welcome, both of you.
Hey, Ancil, great to meet you. I mean, great to see you. Great to see you, Jeff.
Good to see you, Reed, and thanks, Ancil, for having me on today. This is great. It's gonna be a great show.
Yeah, no, absolutely. And I promised you that we wouldn't be talking about Bobby Petrino in this LinkedIn Live. So just saying. Hey, but let's jump right into the problem of that we're addressing today. Was healthcare, and talking about getting the insurance payments that are due. Do these hospitals, surgery centers, clinics? You know, what has astounded me in working with you, Reed, is that how you know what a problem this is, and getting paid for the work that you've done.
That's right, Ansel. I've been in the healthcare business since the 90s. I started out as a community hospital pharmacist, worked in the business for various vendors for a long time. And we kept seeing over and over both community hospitals and specialty physician practices and ambulatory surgery centers in our work with various vendors over the years, just continuously having the problem of not getting reimbursed everything they were supposed to get, whether it was denials or underpayments from insurance companies. The payer market has just been increasingly having the playing field getting out of whack, and the playing field is just not level, where payers are increasingly underpaying providers more and more, and using artificial intelligence more and more to really tip the scales in their favor. And so we decided at SlicedHealth to build a platform that would really level the playing field and give providers the money, the ability to get the money that was owed to them, and make sure that they were getting insight into what was owed to them every day as every payment came in. And there have been platforms that would do this in a variety of ways over the years, but they were really geared toward large health systems and big enterprise health systems that had a lot of resources and a lot of money to roll these systems out and support them. And we decided to focus on the rest of the market, the community health systems that are under 250 beds, and also specialty practices and organizations that had a lot of dollars going out the door, but really didn't have the massive staffs and massive amounts of money to deploy consultants and resources to implement and support these systems. So we decided to use new technology and cloud services to be able to do this in a modern technology way that gave organizations the ability to find this money every day so that they could be sure that they got everything that was owed to them contractually. Does that make sense?
Yeah, it's amazing. I mean, I've gotten to know you over the last year, Reed, and the work you're doing is so important for these small rural hospitals and the clinics that also are involved in underpayments and denials, and they're not getting the money that they're owed. And you know, how are they supposed to survive? And a small community can't afford to lose their hospital. First of all those workers they lose, and then where does the community go?
That's right.
So the work you're doing is just unbelievably important. And, could you share some of the stories that you've experienced over the last year and how you're actually disrupting the market?
Yeah, we've implemented this system in everything from really small critical access hospitals with less than $10 million in net patient revenue, all the way up to hospital systems with multiple hospitals with $300 and $400 million worth of net patient revenue, and then really lucrative orthopedic practices with hundreds of physicians and mid-level providers that were making a lot of money. But they run the gamut, but they all have one thing in common. They would see underpayments and denials worth thousands and even in some cases millions of dollars every year that were being underpaid them, and in many cases they weren't even aware of the scale and the magnitude of what they were being underpaid. And I think they thought they had a good grip on the problem, and then when they implemented our software and started to see the payments coming in every day, and then we showed it to them on a dashboard, they were all astounded at the scale of what they were doing. And we implemented the software at one health system in Georgia that was an orthopedic hospital. They found something like $500,000 in the first month in underpayments, and so it was really just a glitch in the way the payer was reimbursing them for implants on surgical procedures. And so it was one single payer, one single implant that was being left out, that was being reimbursed for. So it can be something really simple that's just being overlooked in the way the payer's reimbursing for a particular procedure, that just needs to be fixed. But what we find is there's these systematic errors that are occurring all throughout the healthcare system that people just need to stay on top of. And it's just really kind of inefficiencies in the reimbursement system that are happening all throughout the healthcare system. Everybody needs to be just on top of, and you really can't do it manually. It's got to be done with technology because it's such an inefficient process that's going on.
And the key thing you just said there was in the first month. I mean,
Yep.
this implementing your SlicedHealth program into these hospitals, it's not a major investment of resources and capital and people and time. You're going to see an immediate sort of result within weeks of the implementation of the software.
Yeah, that's a great point, Jeff. We decided to focus on a fast return on investment, getting the software up and running quickly. The older platforms that have been around for a long time, you would see they would measure the implementation in several months, if not a year or more. We decided to make our implementation with the modern technology platforms that are available with cloud solutions, like Amazon Web Services is what we're built on. We decided that we wanted people to measure their implementation process in weeks, not months and years. And so we have a really rapid implementation methodology. We also wanted to focus on people not having a big capital outlay, so there are no upfront costs with the way we do things. You just pay a low monthly subscription fee model, and we even have an at-risk model. So if you're interested in us taking on the finding the denials, going and chasing down the underpayments by filing appeals for you, we can take on going and getting the money for you and taking on that part of the revenue cycle for you as well. If you're interested in an at-risk model, we'll do that as well.
Well, it's incredible work, and it's so important. These hospitals that are struggling, they need to contact Reed Ligon.
Absolutely.
Well, I mean, I think what we're all seeing right now, post COVID, are the revenue, these hospital, clinics, whatever, they're struggling with revenues, and that's which amazes me. And when you drill down into this, are they actually getting the money that they're due? Let's just start there,
Right.
And this is not, I mean, it's not something, that's, we're not trying some new gizmo or new idea here. Let's just get the money that's due us. And
that's right.
And I guess, and what I hear, when I talk to clinics, and hospitals, they tell me they're being deliberately underpaid.
Yeah, well, I think it's, maybe there's some deliberation to this. Maybe it's just inefficiency and systems that are not really good at what they're supposed to be doing. Maybe it's a little bit of both, but at the very least, we know it's happening. We know it's been increasing over the last few years. We know it's a very big growing problem, because when you talk to organizations like HFMA who study these problems, they see the trends going up in the industry. So when you read industry publications and you go to industry events, the information's being reported that denials are going up, underpayments are going up. So we know this is an industry trend that's happening. And it, when the numbers were really small 10 years ago, people could stay on top of this manually. They could do spot checks and audits and have consultants come in once a year and stay on top of it. Those days are gone. These problems have grown in a magnitude that if you don't have technology in place that looks at every claim every day, and the contracts have grown to be so complex that if you're not on top of this with technology, you will be in a bad place and get hurt really bad financially. So you need technology like ours to stay on top of it. And so we decided we're going to bring technology that's modern, that can be implemented quickly, that can be affordable, and make sure that you're going to have something that gives you an opportunity to do this without massive resources on your side. So we do the work for you. We take the work off your plate, and we make this easy, and we give you an ROI that makes sense. So we're really trying to be disruptive and bring something disruptive to the market that makes sense and makes this a no-brainer for people.
Yeah.
Well, I think that one of the things that if I'm a CEO and I'm sitting here watching this thinking, okay, I've got to go hire new people, or I don't have the resources to implement this thing. And, that's really where I see where you're disrupting, is that you're getting it in there and getting it. I mean, you're using your team to do that.
Yeah. Hiring new people is a non-starter these days. When you go out there in the market post-COVID, we all know that, employment shortages are a real problem. There's a labor force shortage and a labor force problem out there in the market, and finding good people is just something that is not possible. So, we want to bring, the solution that takes that burden off your plate. You don't have to worry about finding the people and staffing this and having to do the implementation and maintenance of the system. We got all that, and we're going to take the work off your plate. So, we also do analytics as a service. So that's another piece of this puzzle. Part of our platform is that we'll take your data, and rather than you having to hire analysts to do analytics and build dashboards and things like that, we can also do analytics for you as well as part of this platform. Since we already have your data, we can build all sorts of dashboards for you and show you how you're performing as a business as well.
Reed, I should know the answer to this question, but I'm going to ask it. How does underpayments and denials affect the physician? Or we know that if a hospital is in trouble, that all the employees are affected. But I was thinking about underpayments, denials for that orthopedic procedure that you were mentioning, where it was a small item that you've discovered. Is the physician being penalized during this?
Well, certainly, if you're not getting the money in the door and the physician's doing all that work and they're not getting paid, if they're doing a knee replacement at an orthopedic practice and they're supposed to get reimbursed, $20,000 or $25,000, and they're only getting half that, that's a big deal. that they're only getting half what they were supposed to get paid for the work they did.
Yeah.
That's a big deal. But then obviously that's going to affect staffing levels if they're not able to pay all their employees that were part of that procedure, right?
Sure.
So yeah, that's going to affect the overall practice because they're not getting all the money they were supposed to get to employ all the people that were supposed to be a part of that team. Sure.
Yeah, I mean, I don't know that we've ever talked.
It's a downstream effect,
it's
right?
a downstream effect. So, we're talking about the enterprise, but everyone's affected by underpayments. Everyone's affected by denials. So,
Absolutely.
if you're hearing us and you're a physician, let's talk. Let's get some
Absolutely.
conversations going.
Yeah, absolutely. And the thing is, like I said, I think when we talk to people, everybody knows it's a problem. Everybody's aware of it. I think what everybody's not aware is there's a pretty easy way for us to come in and help you fix this. It's pretty painless. We just have to get your claims data, and we get that straight from the claims clearinghouse. There's no interface for us to build. We just get a simple file drop in the cloud from the clearinghouse. We get your commercial payer contracts and your fee schedules from you. We build those, model those out in our engine, and then we're off and running. And that usually is just a 4 to 6 week process for us to get up and running, get everything going, and then all of a sudden we're starting to show you a return on investment. And so from there, we're meeting with you. We have what we call a white glove service. We meet on Microsoft Teams with your team once a week. And then over a period of a few weeks, we'll start to show your team where the opportunities are. And we want to make sure you're successful, because if you're not successful, we're not successful. Mm-hmm. And we want to make everybody raving fans of SlicedHealth. So if you're a raving fan, you're going to go out and tell everybody how great we are, and we're going to grow, and we're going to win together.
Well, that's a good place for us to pause, and because we're going to be doing a series of these talks. But now, how can folks find out? How can they have a conversation? Let's say they just want to have a quick conversation. What's the best way to do that?
Well, there's a couple of ways. You can go to SlicedHealth.com, and you can go right there to our website, and you can book a one-on-one meeting at SlicedHealth.com, and you can book a meeting with our team, and we'll do just a high-level overview if you want to just get to know us, or you can book a demo at the website, and it's just a contact button where it says there you can book a one-on-one meeting. You can also get all sorts of information about us at the website and learn more about our solutions. Besides contract management, we also do business intelligence, as I was saying, and we do that as a service where you don't have to do any work. You just walk in every day and consume the information. We do price transparency to help hospitals comply with the price transparency laws, and then we do the No Surprise Billing Act that provide claim estimates for hospitals and practices. And then also you can go to our LinkedIn page, and you can follow us on Twitter.
Outstanding.
Awesome.
Outstanding. Yeah. Hey, Reed, thank you for joining us today. And I'll just also say to our audience, hey, if you can't remember any of that, just message me, and I'll connect you with Reed and his team. And very excited about what you're doing. And hey, more to come. But thanks for taking time today, Jeff. Good to see you, man. And and more later.
Thank you, Ancil. Thank you, Jeff. Take care.
Thanks for being here. Great work.
Bye.